I'm Josh Fenton, CEO and co-founder. It is a spectacular spring day, and we've got a lot of information coming at you today relative to the pandemic. We've got Dr. Phil Chan. Dr. Chan, thanks so much for joining us.
Thank you for having me.
Okay, just so everybody knows, Dr. Chan has worn a lot of hats during the pandemic, and one now as a major consultant to the Rhode Island Department of Health, and you've been a go-to guy since literally, I think the first time we interviewed you on this was somewhere around the beginning of March of 2020. So a long-standing relationship on this issue, and you've got a lot of expertise. Let's talk about the Rhode Island numbers. Transmission rate up a little bit over the past few days. The percent who are testing positive is up to about 7.5, but that's a lot of self-selection of who's getting tested. Good news is hospitalizations down and down significantly. Talk about what you're seeing in these numbers and what Rhode Islanders should think about the numbers right now.
Yeah, thank you, Josh, for bringing this up. You know, other places around the world, including Europe, are seeing a significant uptick in new cases, including hospitalizations in some countries like the UK. And a lot of this is due to the BA2 Omicron variant. It's more infectious, it transmits easier, there's good data on that now. And so we know in the US, including here in Rhode Island, the BA2 does cause the majority of cases now. So we're actually seeing a BA2 effect across the US, including here in Rhode Island. The good news, as you pointed out, is that hospitalizations, deaths are still low, plateaued, so that's a good sign. We do anticipate potentially a slight uptick. That's what our models are showing at the moment. And the reason for this is because we're just coming off our Omicron surge, and so a lot of people have natural immunity, and that combined with vaccinations, with boosters, does give our population a degree of immunity.
Yeah, Eric Topol from Scripps, who's been maybe the best national expert on tracking the pandemic over the past 2 years, had a little bit of a cautionary tale last week in one of his writings about, listen, much more infectious and potentially a little bit more serious than what we call, sort of Omicron, the original version. We're lucky that the weather's hitting as it is. We're outside. We're, in a lot more safe zones than being cooped up in the dead of winter. Are we going to see a surge of any significance, or will we see more of a blip and then a flattening out?
Yeah, it's a great question. I think in most parts of the U.S., including here in Rhode Island, I think we may see a little bit of a blip, not much. So I'm going to be cautiously optimistic. And that's again because we have seen a huge surge of Omicron, and that does confer some immunity. So it's important, incredibly important for people to get vaccinated if they haven't been vaccinated, and to make sure to get boosted. There's great data, of course, that boosters protect against Omicron and severe illness. And at this point, Josh, I think I'll just mention too, the name of the game in the long term, as SARS-CoV-2 becomes endemic, present in the population, is really preventing severe disease, preventing hospitalizations, preventing deaths.
Yeah, Dr. Chan, I'm always perplexed on this number. More than 90% of Rhode Islanders got the first 2 shots, or in the case of J&J, got the first shot. But in Moderna and in Pfizer, they got the first 2 protocols. What's amazing is we're only hitting at about 40% of the boosters. Like, if you got over the issue of getting vaccinated, why wouldn't you get boosted and run, don't walk? Like, you realize life is pretty good not wearing a mask, being able to go to a restaurant, being able to go to a college basketball game or anything else. Listen, I'm eligible for booster number 2, the 4th shot. I'm getting it next week.
Yeah, Josh, I mean, I agree. I think it's critical for people to really get that booster shot, especially if they have not received their initial vaccine in a while. There's good data, there's lots of data now that booster shot is really needed to protect you against emerging variants, Omicron, BA2. And once you have that first booster, you really are protected against severe illness. So definitely want to encourage people to get it if they haven't already.
Yeah, I mean, listen, people are returning to normalcy. I believe it was last week skip the weekend when so many flights got canceled, but last week was record numbers of flights in the history of travel in the United States. People want to get out and do things. That booster shot, if you haven't had a booster shot, is critical. And then let's just talk about the second booster. The second booster, sort of begrudgingly, was approved by the CDC 10 days or so ago. Right now it's approved for those who are over 50 years of age, correct?
Correct. So the CDC, I think what people are hearing and seeing from the CDC, from other experts, is that there's still not a lot of data out there about the second booster shot. So what people are feeling, I think, is due to this lack of data, is that no one's really quite sure what to do. And we saw this actually with the first booster shot. We've realized over time how important that first booster shot is. With this second booster shot, there's still very limited data, and that's why a lot of people, the CDC experts, are kind of hedging a little bit about who should get it. I think over time we'll have a lot more data, but to your point, exactly. These are the people that you want to think about who should get this second booster shot are those who are really more at risk, those who are age 50 and older, or those who are 12 and older who have a compromised or weakened immune system.
Okay, let's go back to the first booster shot if we haven't confused everybody enough. If you got both your shots last April, lots of people did, that's really when it started to take off, March and April of 21, when people really started to get vaccinated here in Rhode Island, and you got your second vaccination in April of 2021. You were at about 94% protected if you got Moderna or Pfizer. If you haven't gotten a booster since then, you're down in the teens from a level of protection. It's critical to go and get that booster shot if you're kind of returning to normalcy.
Yeah, thank you for that. Absolutely agree. I mean, again, there's so much data now about the importance of that first booster shot, and especially against Omicron, especially against BA1, BA2. So really just want to hammer that home that people really need to get their booster shot. One, because it amplifies the immunity, and people do see waning immunity against those first two doses.
Okay, Phil, let's go back 2 years ago. You were in the GoLocal studios. By the way, I don't think we were wearing masks. This was in, as I said, I think maybe about the second week of March. What have you learned in the 2 years?
I don't even know where to start with that question. It's like, it's hard to believe, first off, that it's been 2 years. I remember in those early days, no testing, no masking, no PPE. I mean, we basically had no supplies. So we've come so far, and I really do think the biggest advantage has been these vaccines. We really lucked out, in my opinion. It's really a marvel of science in general, including our scientific infrastructure here in the U.S., that we've been able to develop these so quickly and effectively. They're so safe, et cetera. And also treatment. So again, I know a lot of people are so nervous about this. You mentioned people are flying, which is great. Everyone's been inside almost, for at least a year and a half. But these advances, just on how quickly we're able to come together as a world, as a scientific community, to have these effective prevention vaccines, preventative vaccines, as well as these medications. It's a different world now, and hopefully we can prevent people from getting severely sick and from being hospitalized and dying.
Did you learn more in medicine in the last 2 years than all your previous years?
I have learned more in public health, and we in general, we as a scientific community, I think everyone has learned so much about public health, so much about how respiratory viruses spread. That's been a moving target, understanding how infectious COVID is. We're still understanding how these viruses evolve, the mutations. So it's been a steep learning curve. And I have to say, for public health, for sure, it's the amount of information that we've all processed and synthesized has been amazing.
Dr. Chan, what's your biggest worry going forward? Where we are right now, people are feeling comfortable, they're feeling confident, they think the worst is over. What's your biggest worry?
Well, I'm hopeful that the worst is over. I think my biggest worry is that we'll see another variant that will overcome our vaccines and lead to a high degree of morbidity, mortality, hospitalizations. I'm hopeful that will not happen because remember, it's to the evolutionary benefit of this virus not to kill the host, the person that it's infecting. So I'm hopeful that we're going to enter this steady state where there'll be some COVID, but it won't lead to severe disease.
Dr. Chan, you get the last word. What should Rhode Islanders be thinking about?
I just want to first off thank Rhode Islanders for your patience and flexibility and trust in public health. There's a lot of compliments that I get personally, that the Department of Health gets, and I just want to thank Rhode Islanders in general for trusting us in public health to help guide you. I know that we haven't always had the answers. We've figured out a lot of it together. And us here at the Department of Health, my colleagues in medicine, infectious disease docs, doctors in general, other providers, we're excited to get us through the pandemic, and hopefully we're going to be in a much better place now and in the future here.
Dr. Phil Chan, Rhode Island Department of Health, as always, thank you. Appreciate your expertise over the past 2 years. It has been quite a journey. For everybody else, stay tuned. If you haven't seen it, Providence has a new superintendent. He was the acting superintendent, but he has been named permanent. There's a lot of news. GoLocal's got a feature on an incident over at Providence Place Mall. And also, maybe the best read story is one about a very well-known, spectacular Providence restaurant who has up and moved to Newport. And that's an extremely popular read, both last night and this morning. For everybody, stay healthy, stay safe, enjoy this great weather. If you haven't gotten boosted, call CVS, call Walgreens, call your primary care doctor. Get it scheduled, get it done. The weather's too nice, there's too much fun to have not to be fully protected. Thanks, everybody. Stay safe.